Madam Speaker, my question is for the Minister of Health and Wellness. Every day in this province, ambulances and patients are tied up, waiting dangerously long times to be offloaded at the hospital. On a recent Tuesday evening, I was told that 17 paramedics were at the QE2 waiting to offload patients. In her report on this issue, the Auditor General said, quote, "We recommend the Department of Health and Wellness publicly report weekly ground ambulance response times by community and offload times by the hospital." And I can table that. Presumably the Minister has this information. Will she commit to reporting it weekly?
I recognize the Honourable Minister for Health and Wellness.
Thank you, Madam Speaker. Thank the member for the question. So certainly we are very committed to being a transparent government that reports on a variety of metrics, and I would point the member opposite to Action for Health. So on a regular basis, not always weekly, but on a monthly or quarterly basis, sometimes annually, depending on the metric, we do post information there so that Nova Scotians can see how the system is performing. Not always are those the best outcomes that we'd like, and that is those are the places where we focus the most. So I would say that we are very transparent. We are very committed to being transparent with Nova Scotians. We continue to work with the provider as well as Nova Scotia Health around offload times as well as other metrics, and I would point the member to the Action for Health website.
I recognize the Honourable Member for Dartmouth North.
Madam Speaker, the current standard says that an ambulance that arrives at an emergency room should be able to offload the patient in 30 minutes or less. The government's most recent public data shows that for the week of October 1st, in the Western Zone, the average offload time was 88 minutes. In the Northern Zone, it was 92 minutes. In the Central Zone, it was 139 minutes. And in the Eastern Zone, it was 150-minute average. An average wait for the patient to be offloaded into the emergency department and the paramedic to get back on the road, which is 5 times longer than the standard. But when it comes to what is happening at each individual hospital, people are left in the dark. So why is the government hiding this data?
I recognize the Honourable Minister for Health and Wellness.
Thank you, Madam Speaker. And certainly there is no attempt to hide any information at all whatsoever. We're not trying to hide it at all. In fact, we're the first government that has an Action for Health website that actually shows the data that's happening in the healthcare system. What happens is we're working very hard across this province. We have a number of places where the offload times are meeting standards. We look at places like the Aberdeen Hospital, we look at St. Martha's Hospital, and we look at all of these hospitals, and we take what's happening there and we scale it as best we can. There is nobody taking their foot off the gas in terms of response time. We are underbedded in this province, in long-term care and in the hospital. It has been for decades. We also need to increase staffing. So there's a ton of work that's happening around offload times.
I recognize the Honourable Member for